on in. Hi, how are you doing?
Good, how are you?
Good. My name's Kayla. I'm going to be the nurse taking care of you today. How are you doing?
Good.
Good. Okay. So I'm just going to ask you a couple questions. Can you go ahead and tell me your name and your birthday?
Lindsay Cheatham, 04-1889.
Okay, so I'm going to go ahead and wash my hands, gather my equipment. I have my stethoscope, my pen light, and my otoscope if I would have one. So I'm going to ask you a couple questions beyond your name and your birthday. And can you go ahead and tell me where you're at?
I'm at the clinic.
Okay. Can you tell me why you're here?
Just for a general checkup.
Okay, great. So I can tell by Lindsay whenever she came into the room, her gait was good. She didn't have any involuntary movements. Her range of motion seemed to be appropriate. She's well dressed for the season. She's appropriate. And I'm going to go ahead and move on with the rest of the assessment. So initially I'm just going to feel your head and check your hair and just checking for any tenderness, any bumps, or anything out of the ordinary, okay? Okay. Do you have any tenderness with any of this?
No.
Okay. And her hair isn't coarse or brittle. Okay, good. I'm going to go ahead and just palpate her frontal sinuses with firm pressure. Do you feel any tenderness with this?
Mm-mm.
Okay. And the maxillary? Any pressure with that?
No.
Good. I'm going to check for the temporal artery. Good. And I'm going to have you open your jaw and close. Good. And I'm checking for I'm checking the temporomandibular joint. I'm going to go ahead and palpate behind your ears, checking the lymph nodes for any swelling, any tenderness. Do you have any tenderness with this?
Mm-mm.
Okay. And I'm going to go ahead and move to, I'm going to go ahead and stay on her neck. I'm going to have you, can you shrug your shoulders for me? Good. I'm going to have you push your head against my hand. Good. And over here. Excellent. Good. So her neck's strength is strong. Go ahead and turn your head to the left. Good. And to the right. And up and down. Excellent. Okay, so good range of motion with her neck. I'm going to go ahead and move to the eye. I'm going to have you, I'm going to pull down on your eyelid, checking the conjunctiva. Okay, the nice pink and moist. The sclera is white. There's no jaundice or yellowing. Her pupils are equal in size. They're about a 3. I'm going to go ahead and check for Perla, my pen light. So just go ahead and stare straight at me. Excellent. And they're reactive to light. They're round. Now I'm going to go ahead and have you stare at the wall. And then I'm going to have you move your eyes from the wall to the pen. And then to the wall and to the pen. So they accommodate. Good job. Okay, now I'm going to go ahead and look into your ear, my otoscope. Okay, and here I'm checking for any redness, and then I'm checking the tympanic membrane for redness or swelling. Do you have any discomfort?
No.
Okay, good. I'm going to go back to your eyes, and I'm going to check your peripheral vision. So I just need you to stare straight ahead and tell me whenever you see my fingers come into your field of view.
No. No.
Okay.
No.
Okay, great. All right. I'm going to go ahead and check the 6 cardinal movements of the eye. I'm going to have you follow my finger with your eyes, okay? All right, excellent. All right. And at this point, I would have her stand, and I would have the Snellen chart, and I would stand, make sure that I'm 20 feet away from her, and have her read, cover the right eye and read with only her left from the bottom up, and then switch eyes, cover her left and read with her right from the bottom up, then uncover both and have you read both from the bottom up, okay? All right, so we're gonna move back to the ears, and I'm gonna perform the whisper test. So what I'm gonna have you do is cover your right ear. Excellent. Now I'm going to whisper something on this side, and I want you to tell me what I say, okay?
1, 2, 3.
All right, excellent. Now cover the other ear and do the same thing. 1, 2, 3.
1, 2, 3.
All right, excellent. So she was able to hear me and pass the whisper test. All right, now I'm going to go ahead and move on to your nose. I'm going to first check for patency. I'm going to have you cover one nostril. Good. Now blow out and blow in. Good. And cover the other one. and the same thing. Okay, both ears are patent. I'm visualizing the external nose for symmetry, any redness, any swelling, palpating for any tenderness. Do you have any tenderness?
No.
Okay, good. And this time I would take my otoscope, look into the nose, checking the membranes. They should be nice pink, clear, or pink and moist. And then checking the other. I would also be able to visualize the external and the middle turbinate, and they would be nice pink and congruent with the other mucus and then in the nostril and then in the nose. So at this point, I'm going to go ahead and move on to your mouth, and I'm going to go ahead and just have you open your mouth for me. Good. All right. So her mouth is nice and pink and moist. The buccal mucosa is as well pink and moist. I'm going to have you go ahead and open your mouth and stick out your tongue for me. Okay, move it side to side. Great. Okay, and say "ah" for me. Excellent. Good. Okay. And with the gloved hand, I would also reach in and palpate for any tenderness or checking for any masses. With her saying "ah," I'm able to visualize the pharynx. I would be checking for redness. Her pharynx is nice and pink. There are no exudates present, no lesions. The tonsils are 1+, nice pink, not swollen. And I'm going to go ahead and actually open your mouth again for me. And raise your tongue. Excellent. Okay, put your tongue down. Great. And the floor of the mouth is as well nice and pink. Nice pink and moist. And the hard and soft palate are intact. Her gums appear pink and healthy. There's no swelling, no redness, and she appears to have good teeth hygiene. Okay, I'm going to go ahead and move from the mouth back to the neck, and I'm just going to check for a carotid pulse. Just present, not bounding, 2+. Okay, and along with checking the carotid pulse, I'm going to go ahead and check the trachea. It's midline, good, and check the thyroid for swelling and pain. Okay, all right. Now I'm going to go ahead and place my hands on your shoulders and go ahead and have you shrug up against me. Good, so she's got good, strong shoulder and neck muscles. All right, now I'm going to move on to the chest. Take a deep breath for me. Excellent, and let it out. Great. With the deep breath, her lungs expand symmetrically, and I'm going to go ahead and at this time feel the chest for any masses. Okay. Do you have any pain or tenderness there? Okay, great. I'm going to go ahead and listen to her lungs. Check the breath sounds. Take a deep breath for me. Let it out. Good. Take a deep breath. Let it out. Excellent. Okay, and her breath sounds are nice and clear. I'm going to go ahead and palpate and percuss, checking for any dull or any dull sounds, checking for consolidation. Okay, great, and there are none. Now I'm going to check for pectoroliqui, bronchophony, and egophony. Initially I'm going to check for the pectoroliqui. I'm going to place the bell of my stethoscope on your skin, and when I do, I want you to whisper the words or whisper the numbers 1, 2, 3 for me. Good. Okay, and I wasn't able to hear any of that, so that's a normal finding. If I was able to hear it, it would indicate consolidation. I'm also going to check for egophony at this time, and I want you to say the letter E with each time I place the bell of my stethoscope on your chest.
E, 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 E.
Okay, and I was able to hear the letter E clearly. If I was able to hear the word or the letter A, I would be concerned. Now I'm going to check for bronchophony, and I'm going to have you say 99 for me.
99, 99, 99, 99, 99, 99.
Okay, great. And that was muffled, not super clear, which again would indicate consolidation. Okay, so I'm going to move from the anterior aspect of the chest to the posterior and do the same thing. Initially, I'm just going to palpate and feel for any tenderness or masses. Do you have any pain? Any of this?
No.
Okay. I'm going to go ahead and percuss. Okay. Deep breath. Good. Good. My breath sounds are clear. Okay, now I'm going to check for the same thing that we did on the front. I want you to do on the back. So I want you to say, whisper the letters or the numbers 1, 2, 3. Excellent. And I wasn't able to hear any of that. And say the letter E for me.
E, 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 E.
Okay. The sound was clear, not muffled, and not the letter A. Now say 99 for me.
99, 99, 99, 99, 99, 99.
Again, muffled and not clear and normal fine. Now I'm going to place my hands on the back of your back, and I'm going to check for diaphragmatic excursion. I want you to take a deep breath for me. Excellent. Okay. And my thumbs expanded with her breath, symmetrically and even, which is again a normal finding. Okay, and now I'm going to move from the pulmonary system to the cardiovascular system, and I'm just going to auscultate the cardiac sounds with the bell and the diaphragm of my stethoscope. Okay, and then I would listen to the apical pulse for a full minute and state the beats per minute. While listening to the cardiac sounds, I'm checking for any murmurs, any irregularity. With Lindsay, I heard both S1 and S2 sounds. Her heart rate was regular rhythm. And that concludes the halfway video assessment.